Hi, my name is Gisela Malan, and the topic to present is congenital cytomegalovirus infection. Introduction. Cytomegalovirus infection is the most frequent congenital infection presenting perinatal morbidity and mortality and neurological sequelae both in primary infection and in reactivation during pregnancy. Here get present a little more about what is cytomegalovirus. Nursing application. Frequent and washing, especially after having contact with diaper or feeding small children. Avoid contact nasal excretion or saliva to brushes, food, forks, pacifier. Do not share food, give children wash toys.
In this video, we're going to talk about cytomegalovirus, which we call CMV. And if we want it to be really precise, we should say human cytomegalovirus because there are other non-human cytomegaloviruses. But we're just going to say CMV. So CMV is HHV5, and it's a beta herpes virus. And it receives a lot less press than the other herpes viruses, and that's probably because the vast majority of cases are asymptomatic. However, it can do a number of things. It can cause a mono-like syndrome. It can cause serious infections in immunocompromised people, especially AIDS patients and transplant recipients. And it's also the most important congenitally acquired infection in the US. And we'll talk about all these things later. But although it receives less press, CMV is totally ubiquitous. Up to 90% of 80-year-olds have CMV antibodies. You can acquire it any time, especially early childhood and adolescence. So why is it so common? Well, that's because it's transmissible in so many different ways. It can be transmitted directly from person to person or via fomites in the environment. Sexual transmission occurs. The one thing it can't do is spread through the air like VZV, because CMV does not get airborne. But it's shed from saliva, urine, cervicovaginal secretions, breast milk, even semen. It can be acquired prenatally, perinatally, postnatally. Breastfeeding is a mode of transmission. And then it can also be transmitted in blood transfusions, and even more importantly, in organ donation. So really almost every way that you could imagine. And when kids were studied in a daycare center, a third were secreting CMV in their urine, saliva, or both. So all in all, as you can imagine, because CMV is shed so commonly and from so many different places, it's really hard to prevent transmission. So let's quickly go over the pathogenesis of CMV. So it's secreted in almost every imaginable way. And then how does it infect a new host? Well, usually by getting in through the upper GI tract, the genitourinary tract, or the respiratory tract. So that's actually more common than the blood transfusion, transplant, breastfeeding kind of stuff that we talked about. And from there, it infects lymphocytes that traffic around the body, and it hitches a ride on those cells and spreads to multiple tissues. And whether it causes a symptomatic or asymptomatic infection, cell-mediated immunity is critical in controlling the virus. And then, like a good herpes virus, CMV establishes latency. And the cells that it establishes latency in are myeloid progenitors in the bone marrow. And these can differentiate into circulating monocytes that will also be carrying the virus. So this is a virus that's great at immune evasion. It literally hides out within the immune system. And like other herpes viruses, since it's latent, it can reactivate and cause either symptomatic disease or asymptomatic infection, in which case it can still be spread to other people.
Pros and cons. Complication of CMV infection vary depending on your overall health and when you get infected. A pregnant woman can pass CMV to her unborn baby. The virus in the woman's blood can cross through the placenta and infect the baby. This can happen when a pregnant woman is infected with CMV for the first time or is infected with CMV again during pregnancy. The main sequelae it produces is sensorineural hearing loss. It is considered that is the most frequent cause of auditory involvement of non-genetic etiology. Despite its importance due to its effect on public health, there is a high ignorance of his problem among profession of health and in society.
So now let's talk about the major clinical syndromes that CMV can cause. So the three main ones are infectious mononucleosis, congenital disease, and disease in immunocompromised hosts. Now, Epstein-Barr virus, or EBV, is the most common cause of infectious mononucleosis, or mono, so we're going to talk about mono when we talk about EBV. But just remember that CMV causes almost 10% of mono cases. So let's move on to congenital infection, and that's actually potentially much more serious. So congenital infection happens when a pregnant woman gets a primary CMV infection or sometimes reactivation. And I'm sure you've heard of Down syndrome. You might have heard of spina bifida or fetal alcohol syndrome, but what you probably don't know is that congenital CMV is more common than any of those. And that's probably because pregnant women are so often exposed to young kids who can spread it to them, and also because CMV can cross the placenta. So 1 in 100 babies in the US are born with CMV, and of those, 1 in 5 is going to have symptoms or sequelae. And the disease can range in severity from mild to fatal, but possible signs of congenital CMV infection at birth include premature birth with low birth weight, hepatosplenomegaly, respiratory distress, microcephaly and seizures, and a petechial or purpuric rash. So that's all stuff you might see at birth. And then long-term complications can include intellectual disability, vision and hearing problems, seizure disorders, and problems with weakness and coordination. So finally, let's talk about CMV in immunocompromised hosts. And the issue is that in transplant recipients receiving immunosuppressive drugs or in advanced HIV infection, CMV can reactivate and actually cause serious illness. In fact, CMV is probably the most important post-transplant viral infection. And when you do a transplant, you actually always assess the CMV status of the donor and the recipient, because that's going to determine the risk of CMV disease and also the monitoring plan for it. So what kind of disease does it cause? Well, CMV can cause fever, pneumonitis, hepatitis, colitis, lots of itises, as you can tell, as well as transplant rejection, and it can actually precipitate graft versus host disease. Now, in advanced HIV disease, CMV can also reactivate. And when we say advanced, usually it's when the CD4 count gets below 50. And in that case, CMV is most likely to cause retinitis, which can lead to blindness. And this is what the eye might look like if you looked inside it relative to a normal eye. So it can cause retinitis or colitis or esophagitis. And so these are all the main complications of CMV that you need to know.
Conclusion. In conclusion, cytomegalovirus causes the most frequent intrauterine infection and is an important cause of mental retardation and sensorineural hearing loss. Its clinical presentation varies between the asymptomatic fur and the lethal multisystemic spread.
I was angry. I was angry that I had never heard of it.
I studied child development. I studied psychology, and I had never heard of it. And I was kind of frustrated, first of all, that my son was affected by something that could have been prevented.
My immediate reaction was, how do I not know about this? How have I never heard about CMV?
I lost a baby to CMV. My story is a little bit different than the average CMV family story.
When the doctor suggested that Alex be tested after he learned that there was no history of hearing loss in our family, he suggested we be tested for that he be tested for CMV. And of course, our first question is, what is CMV? We've never heard of that.
We struggled a lot with Daisy's hearing loss because she wasn't diagnosed very early. We didn't know she had CMV, and we didn't know the potential for a progressive hearing loss. And so she was identified pretty late, about 15 months old, with a hearing loss, and then lost her hearing really quickly after that.
For Weston, CMV has really impacted his hearing, and pretty much he started with hearing and ended within a year, no hearing.
By 25 weeks, I went in and there was no heartbeat on that ultrasound.
CMV stands for cytomegalovirus, and it's actually a very common virus. It's the most common virus no one's ever heard of.
It's spread through our bodily secretions, meaning like saliva, urine, sexual contact.
You don't even know you have it. You may have some very light symptoms, but generally no symptoms at all. However, if you're pregnant and you catch cytomegalovirus or CMV and you transmit it to your unborn baby, it is one of the greatest causes of birth defects. It causes more disabilities than things we all hear about, than Down syndrome, than spina bifida, than a lot of those other things.
About 20% of children that are born with congenital CMV will go on to have symptoms, and they can be microcephaly, hearing loss, visual loss, seizures, and developmental disabilities.
The thing you need to be concerned about, it is transmitted through body fluids, and so you don't want to get a body fluid on your hand and then touch your eyes, your nose, or mouth. And they think the most common way a woman gets infected when she's pregnant is through urine or saliva of a young child.
I love my son, and I want to give him kisses all the time, but when you're pregnant, just try to kiss him on the forehead. It's only 9 months. You're already making so many sacrifices, and it's worth it to have a healthy child.
Act as though everyone around you is potentially carrying a cold that you're trying to avoid. You know, the same way that you would if you have another child that's sick with a cold or the flu and you don't want to get it. You're washing your hands constantly. You're not sharing any beverages or food or kisses, anything like that.
For 9 months, if it could possibly reduce the risk of your child having disabilities or losing your baby, it's worth it.